When we're in the flow, release and let it go. Find that missing piece that makes us whole. When we're in the flow.
Hi, Mark.
Hi, Mark.
Now let's see what you're going to talk about today.
Okay, so what I'm going to talk about today is it's to think differently about how we go about our full arch treatment. Because a lot of the times I think as dentists, we all think the same. We do things the same way, we treat patients in similar ways, and to our patients who are trying to figure out who they can trust with this very extensive, expensive treatment, sometimes it can be very difficult for them to discern your practice from every other practice that is out there. And it's for that reason that I want us to think a little bit differently when it comes to this type of treatment. I want us to think differently in three different things. First, I want us to think differently than just a standard old alginate for our diagnostic visits for our patients. Secondarily, I want us to think differently when it comes to surgery, that we just don't open up the case, flatten up the ridge, and then start drilling and putting our implants in. We want to do things from a very efficient and accurate point of view. And thirdly, we want to think differently from the restorative standpoint, because if we've always wanted to get rid of this, now may be the time. And just to show that these just aren't one-off concepts, I'm showing three different patients in each one of these things as we move forward, and we'll see the end results at the very end. So let's begin looking at the diagnostics, is how can we think differently about this visit for our patient? I think every bit of the patient experience begins in this very first visit with us. And when a patient comes in with us and we start scanning them, it can create a very different patient experience for them. If you look at the work of Brzezinski and Yazbalaskalu, what you see is that patients overwhelmingly prefer intraoral scans versus conventional impressions. And this is one of the big things to help us change the way people look and feel about our offices. The other thing which the scans do for us is they allow us to be able to show them their teeth in ways in which they've never seen them before. The patients have never seen these furcational involvements and this bone loss and the gum loss that they have. They've never seen how tightly their teeth are coming together before. And it's these things that will allow us to help them to understand what is actually going on in their mouth and really help us with the practice management side of getting patient acceptance with this type of case. It is from all these different things that we then move into surgery. And I honestly believe that surgery is a byproduct of all the other steps that we've taken in to get to this point. All of our diagnostic, all of our pro steps and surgery all come together into one. And when we also take a CBCT in that first visit, we can sit down with our patients and really explain what is going on with them and really help them understand the treatment which we're going to be rendering. We can show them the teeth that we propose for them that we're going to help move forward with them getting. We can also explain to them as much or as little as they want with the surgical portion of telling them, we've got to create some space here for your prosthesis. We're going to do this with different guides. We can make sure that we get our implants exactly where we want them by using some surgical templates so that we can go ahead and get our implants directly where we need to support those teeth which we're wanting. And we take that digital plan and then move it into the surgical arena. And we do this because if you look at the papers of Giannis and Almarfini and multiple others, what we can see is that guided implant surgery can actually get the implants in with less deviations than we can with free-handed surgery. And if you look at these two papers as well, they talk about efficiencies. And the beauty about doing these things guided is we're able to do these things much more efficient than we would from a free-handed perspective. And it's not just from the surgical side, but it's also from the prosthodontic side, to where when we go ahead and do our conversion prostheses, from the files we can get from Simplant and Atlantis, we can make pre-made provisionals that really make the conversion prosthesis part of this go significantly quicker and more predictably than just taking a denture and hogging it out and going and doing our conversion prostheses that way. The final thing that I want us to think differently about is the way we go about our full arch restorative work. Because this right here, I think, is the part that pretty much scares everybody watching this. And Up till this point, it's honestly almost been blasphemy to do a case like this completely digital. And I'll be honest, I thought this way as well. And it hasn't been until we get really accurate scanners, such as the Prime scan, to where we're getting the cross-arch accuracy that we published last year, getting all the way across the full arch down to 18 microns. And even when we're looking at just the implant scans from a full arch, we can get this down to 43 microns. And this is from one of our papers that is just in the final review right now. But we know by getting a scan that accurate, we can get extremely well-fitting bars, very passive restorations, and know that we're going to be able to provide our treatment to our patients from a restorative side in a very highly accurate, highly predictable way. The other thing which it allows us to do is we can capture all the lovely things that we've got from our conversion prosthesis and from our temporaries in the same vertical, in the same occlusion, and everything that we've already worked out, because all of these scans will come together and cross-arch mount. That's the beauty about these things, of being able to get a very highly predictable result. And I hope that you've seen in just this little short presentation that truthfully, we can think differently about these things, because we can truly achieve truly remarkable results and remarkable patient experiences that are different than all the other practitioners which surround us by doing things differently. Thank you very much.
Thank you, Mark. It's so interesting to see your work. Malena, do you have any comments or questions to Mark?
Yes,
sure you have.
I do. But first of all, thank you very much for a really nice presentation and fantastic work, Mark. Interesting is that we now have on tape that the surgeon is a byproduct to the prosthodontist, which I think is good. Because when I was trained in the older days, we as surgeons were demanding where the prosthodontist could put the crowns, right? But now the scene has changed. So now the prosthodontist and the 3D and the technology is telling us as surgeons where to put the implant, which of course is the right way. But for sure, it's a big help for us now with the technology that we can communicate between the prosthodontist and the surgeon and the lab. So I think that the technology today and what you showed us today give us so many tools others than precision and planning.
Yeah, I think that's one of the biggest things is, it was always very hard in the past when you have a surgeon somewhere else, a restorative doc in different offices, to really get people to communicate together. And I think that is one of the greatest benefits of this technology, is that it brings surgeon and restorative doc together in the same room, and everyone's looking at the same thing. And that's why I think surgery and restorative, they come together as an absolute product of one, so that we can just get the best possible treatment for our patients.
Absolutely. I agree.
When we're in the flow, trust the